measurements or objective things you can see on the brain scan, then it's better it helps to inform you, right? So you know that, okay, there's a certain percentage. So we know that your brain is responding. It may not manifest yet, but okay, it's changing. The converse is also true. Sometimes you can say that, wow, there's a big change they noticed, but on the brain scan it doesn't show. It could be a compensation, right? So it may not be what we want. So I think this layer is useful. It is useful when helping people make decisions. Yeah. Thanks for making us laugh. Yeah, so I'm no surprise that everyone is going to be different now. Okay, let's see if we can. Let's see what interesting. Okay, thank you. How are we with time now? Okay. Do you advise your clients like what to things that they can do in their life to sort of make it better? It's not like an official advice kind, but just from a human being to another human being, like what helps, right? Do you all, is it within your scope to do that? Yes. I think if you all are called to this profession, you all probably will do it no matter what. So maybe I give you a framework that you can use to advise your clients, because there's so many things that can help out there. Right, so how to make sense of it? From a brain perspective, these basically 3 needs that the brain cell or the neuron needs. Number 1 is oxygen. Number 2 is glucose or nutrients. Okay, and number 3 is stimulation. Right, so the quality versus quantity principle applies here. So whenever you think or you are managing a case or looking at a case, and you want to be able to advise them a little bit more holistically, this is a really simple model to use. Right? What can they do to increase their oxygen levels? Go out and play. Right? Don't sit down so much. Okay. What can they? It's like that. These are the things that will help. Right? What can they do to increase their the quality of the nutrients that they have? Well, you got to see what they're eating right now, right? And maybe you can either start by eliminating or adding, right? I think the general advice is try to add first so that you won't feel as though you're taking away things, right? Then you try to crowd out the bad habits. Okay, so nutrients and stimulation. Okay, this part, there's a huge body of research in terms of how to, in general, bring down the sympathetic system, or bring down the lizard brain and just help them chill. Okay, so things like breathing, things like meditation, or if you have patients who stim a lot, one of the insights that I got and I tried out, and it seems to work. The way to look at them is when they stim, it is the brain asking for something. Right? So what do most people do? Because they're in public or something, it's very disruptive. So they say, stop it, stop it, stop it. Right? And they have to stop. Or they try to stop, but they can't. Right? And then if they don't stop, sometimes it flares up. But another way to look at it may not always be true, okay? But another way to look at it is it's a sensory seeking behavior, so their brain is seeking the input. You want them to stop doing that, you give it to them. Right? So maybe I give one example. It will be, and I wish that you all can share also, right? So we can learn from each other. But what I've seen quite recently is you see a lot of playing with the fingers. So the thought process is just, okay, brain is seeking input right from this area, and okay, take a little Velcro and just run it intentionally, right? The hands, and he's calmed down, right? And then when the dad was there, and then he said that Yeah, I tried before. I bought the sensory brush, right? The one side very fine bristles and the other side sponge. But that just tickled the person and crazy. So everybody is different. It just so happened we stumbled onto a kind of stimulation that that brain wanted, right? So it was a little bit more coarse and more intense. Anybody heard of Temple Grandin before? She is. There's a documentary about her. She basically is autism. Had autism, and she cured or helped herself regulate. The cattle when you own a farm and you grow cow or cattle, and eventually you have to sort of slaughter. Last time, right, whenever they did that, it was a mess because they know that they are going to be led to slaughter, and it's just everywhere. So she is the one that kind of developed a system to calm them down, so that they can be slaughtered easily lah. Okay, and in her system, right, every time she was going to have a meltdown, she would run into this area where it compresses, right? It compresses the cattle, and she calms down. Right? So that is an example of giving the brain what it wants. Of course, there are logistical constraints, right? If what they're doing is causing harm, then there's or long-term harm, then there's you've got to strike that balance. Okay. So these are the neuron. We have oxygen. We have the quality of the nutrients that you give it. And if anybody's interested in nutrition, a lot of that kind of supplements or nutrition that is good for the brain will be related to the mitochondria. Right. So any supplements that would boost function of mitochondria, the energy powerhouse of the cell, you can do your further research there. Okay. And last one was activation. That was very general activation that we talked about, but there's also specific activation. We talked about which the intention of it is to change brain scan. Right? So we can change cortical scans from peripheral stimulation. Okay. This is the principle of neuroplasticity. Right? So neurons that are connected via this thing called synapses. Use it or lose it. So the more you use it, the stronger it becomes. You don't use it, it sort of thinks it's irrelevant, and okay, you don't need it. Okay. This one, we'll talk about some case studies soon. But in general, I want to take you through kind of what is the experience of patients when they come in. All right. So this is our 4-step framework. We want to map it, understand it, rewire it, then remap it again. Okay, so number 1, map it. We do the scan, and let me see if there's a picture of the scan that comes up. Are you all familiar with EEG? Most people, when they hear EEG, right, and they get it done in a hospital, it's very traumatic because they glue the electrodes to the hair with paste, right? It's very uncomfortable, okay? And we struggle with that a bit because they know they're coming for a brain scan when they come to clinic, and they remember that, and then they just melt down, right? But the way we do it is slightly different. We use the cap. So it's a cap that is customized to different sizes of the head, and on the cap there are already electrodes, right? They're distributed in a way that is standardized. So when research is done, we know what areas is affected, right? So it's for that purpose. So it's at the very most, right? It feels like wearing a swimming cap, and then there are electrodes on it. We need to put a gel in it, but it's not the sticky kind that will stick it to the head. It's gel. Some people just leave it on water soluble, start their hair, right? So it's a lot more gentle on the kids, and it depends on your experience whether you should show them the needle, because there is a needle syringe looking thing which is very scary. Some kids, you want them to understand it, and some kids you just gotta hide it, right? You cannot see it, right? But for most of the cases, it's just this, and no matter what, we still need to get it, right? So We've had cases where we need to sit down and really hold the kid down, and at the end of it, like father sweating, mother sweating, right? Clinician sweating. But the information is needed because it gives us, lets us know what to do next. And over time, because we have to do a scan again, we find that they are able to better regulate themselves. Then of course, it will be easier to do, right? And some of them, they become so pleasant when you do the EEG. It's very relaxing, right, for everyone. Okay, so method. The second one, you need to understand it. So in the initial consult, we will do the recording, get all the information. By the way, we do a 3-minute eyes open recording and a 5-minute eyes closed recording. They don't have to be doing an activity. I think most people will be glad to know that okay, they can be like watching iPad also. I think the iPad is the most effective so far to calm people down. But they can be watching iPad. We just need to get clean data because if we don't get clean data, then this, the information is not good or not useful, not accurate. Right? So that's the method. And after the initial consult, we take all the information, send it over to Dr. Beck in Perth. So he's the one that does the analysis, and when he comes back to patients, they will speak directly with him. Okay, so and he will report, do a report of findings, and he will do the recommendations as well. I realized that, yeah, surprisingly, not many people get that. So a lot of times when they go and do some tests, right, they come back, it is just maybe they subcontracted out, right, and then come back, and then you just do this, right? But this guy is the one that does, he's the one that does the analysis. So carers, depending on what your knowledge level or how interested you are, speak to him and he can help to answer those questions. Okay, so they get the information, and then part of the plan or recommendations that he will give will involve a set of stimulations. They will be very familiar things. It can be, example is soft, deep pressure, right? So soft tissue massage, vibration using a massage tool. But usually what we've seen is only on one side of the body. So deep tissue, vibration, and we do joint manipulation, all the peripheral receptors. At the same time, in the same session, they'll be also doing some eye tracking exercises, so smooth pursuits, right? And some sort of mental exercise activity. It depends on the brain scan. So it could be like finding, where's Wally? Finding the character, right? Or it could be maths, right? Then some people have been called Jer before, right? So it could be maths, and a combination of all these things. By themselves, they don't really have an effect. But when you combine them together, it helps to kind of target the area of the brain that you want to affect. Okay, so as more data is, we get more data with each treatment cycle. I'll explain what a treatment cycle is later. Then we add and layer on more nuanced things, right? So we do also have direct to the brain kind of stimulation, right? So if you've heard of TDCS, which is transcranial direct current stimulation, we use that as well, but not in the way that most people do, because how do most people do TDCS if you've explored it before? This montage is generally good for this, right? I want to shift my brain to this direction. But then, right, that doesn't consider that curve that you saw. And also, it doesn't consider the settings that you use, right? Because the difference between, like, for example, 1 milliamp and 2 milliamp, for certain populations, the effect under the cathode on one side of the sponge is completely different. Right, so TDCS is putting 2 sponges on areas of the brain and running a small current through it. It's not electroconvulsive therapy, so there's no boom shock. And there's no like memory loss or things like that. They call it sub-threshold. That means the stimulation is not enough to make like your finger move. It's not enough. Right, it just brings you just close to the threshold, and then you still need to do something to push it over. Right, which is all the other stimulations that I talked about. Okay, so that's transcranial direct current. Okay, so we are at the rewiring it part already. So after you talk with Dr. Beck, you give you recommendations, and then you embark on this neuroplasticity plan. Right, the plan is 18 sessions, and each session is about 20-30 minutes. I think we'll go more into that later. Okay, so after you finish that 18 sessions, and it's quite standard usually, we'll do another brain scan. Because the first one is to establish baseline, and then a set of stimulation, and another one. So you can see the difference. How is your brain responding? Is it responding as fast as we expect, or is it not? That will also inform us on whether the set of stimulations that you're having now is having a good effect. So sometimes it could be the exact same, if they go another cycle, exact same thing, right? But that's because we know that, okay, it is having the effect that we want it to have. Okay. Stimulation techniques that we use, talk about manual therapy, which is the soft tissue massage. It doesn't have to be very specific. My background is a chiropractor, so I do, if I want to, I can go like really deep into that stimulation. And of course, if people come in with headaches or issues, yeah, we help them as well. But then we also have people who are counselors, right? We also have people who are physiotherapists. In Perth, there's an exercise physiologist, right? So as long as, because your qualification is not as important as your ability to connect with people, right? So one of your colleagues said that, yeah, education starts once you leave school. Yeah, it's really, really true. I wasn't prepared for this at all, okay? But it's fun. Manual therapy, we also do low-level light stimulation, so it's cold laser. This laser, right, is not the kind that we use to remove tumors, that kind, but it's a very low level of laser, and we found that that laser, again, the intention is to bring a set of areas in the brain or neuronal pool up close to threshold so that we can kind of get it to fire. Okay, so that's what the low-level light therapy, photobiomodulation is used for. I don't have that video, but I've seen before in one of his presentations, the actual image, right, of the neuron, the brain cell, shine the light. It's like a tree, it kind of grows in that direction. Right, so in a sense, you can control the way that the plasticity is happening. Because if you don't have that, right, it's just going to grow up, right? It's just going to grow everywhere. But now we can direct it a little bit and then measure the response. Okay, so that's light, electrical. Talk a little bit about the transcranial. We also use like a TENS machine. So some people use it for pain relief, and some people use it for muscle activation. We also use that stimulation because all these things stimulate different receptors. Right, so we use that. Breath work. Okay, so there's things that they do in the clinic, there's also things that they do at home. So there'll be some sort of breathing that they recommend. I'll tell you what the breathing is now, so you get something. It's basically trying to make full use of your diaphragm, right? So it is to breathe in, you can do it through your nose, and at your maximum inhale, at the top, suck in 2 deep breaths. So it's a bit like this. And then hold it. All right. Okay, about 4 counts, and again, let it out through your mouth. Slowly, very, 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 very slowly. Right, so it's not prescriptive because everybody has different breathing rate. All right, so that's why I say counts. All right, so if you breathe in for about 4 counts. If you breathe out like 7 counts. Sorry, if you breathe in 7 counts, hold it for 4 counts, and then let it out for about 8. All right, so 4, 7, 8. There is a guy called Andrew Wells, if you guys are into this kind of breathing work. Okay, so what that does is, diaphragm, you use the whole diaphragm. Okay, whatever they have, you want to maximize it. And for kids, if they can't listen or they can't follow instructions, don't force them, just let them play or tire them out. Because at the end of the day, right, as long as after what they're doing, they're like panting like that, right? That's great. Okay, so visual mental. Okay, this is very hard to explain because it's different for everyone, right? So I talk about Wally finding things. Okay. At home also, there's audio stimulation. So they'll be listening to like a piece of Mozart, either strings only or piano only piece, only in 1 year. Okay, so if you look at it in total, it looks like we are trying to weight, sensory weighting of one side of the body, and see how the brain responds. Okay, so that is pretty much how the whole program looks like. Right? So things you do in the clinic, things you do at home. We talked a bit about supplementation. There is recommendations also, but we are not functional medicine. I think most people who have come to us, they usually have gone to one person already. So maybe they're on a gluten-free diet already. All right, poor thing. All right, or they are on some elimination diet already done. Right, so but that is, you can go down that road also. Okay. So mapping, understand, then we reassess after the stimulation, and then rewire, and so this is like iterative thing. There's no, in a sense, there's no end, but just like how everyone is individual, we work together with clients to figure out, have you reached your goal? If you reach already, then okay, we need to taper you off. Right, so we'll try to, our goal is to help people get to the level that they want to, that they're comfortable, and then once they hit there, right, we discharge them by slowly reducing their hand holding, right, and then we measure, see whether they're okay, and then off they go. So far, after listening to kind of what I went on and on about kind of what we do, is there any questions that come up after listening to this approach? Because when I was sitting there, I will have some already. Okay, so if you have some later, ask. Okay, so this is just more information about TDCS, which is the transcranial direct current. Okay, because every time people hear direct current, they get a bit freaked out. But electricity, it's safe, right? And I would tell people that you don't really need to feel something in order for it to be working. Right? So if you do feel something, it's a bit like a tingling feeling, or it could be maybe just a response to the saline or the salt water that we put in the sponges. Okay, but it's not something that's going to zap you or traumatize you in that way. Okay, so that is safe. Okay. And so far, there's no evidence of adverse side effects. Okay, typical journey. The initial consult, 90 minutes. Usually, don't need so long. We assign 90 minutes because sometimes you cannot rush things, right? So it could be done actually maybe in 20 minutes, right? But some people maybe 3 hours. Okay, you never know. So it's your own judgment call, right? How we're going to do it. And then the call with Dr. Beck after we get the data is 20 minutes, right? So clients and I think social workers, case workers also can be on the call. I've even had there are other GPs or doctors looking after them. They're interested in it, so they join the call. I have principals, okay, principals of the kid join the call, but that's how persuasive the parent is to get them on the call. Okay, so each plan, neuroplasticity plan, we call it a cycle, okay, is 18 sessions, and after the 18 sessions of all the stimulations that we talked about earlier, and the home exercise and supplementation, another assessment is done. This one doesn't take so long because usually they are more calm by then. All right, and then again, there's another consult with Dr. Beck. Okay. We recommend a minimum of 2 cycles because of the data points we need to gather. If we don't have enough points, we don't know where you're going, there's no trend. All right, so that is the process, and you can imagine it might be a long process for some people. But if it provides clarity, certainty, I think it's useful. Okay. So we help a range of individuals, right? So adults, children, they may or may not have a neurological condition. So stroke, autism, epilepsy, brain injuries, ADHD, PTSD, concussion, spinal injuries, depression, anxiety, and addiction, migraine, and the very chronic ones like Parkinson also, but we don't see a lot of that. Okay, so we help all of them, and if they don't have a diagnosis, we still can help them, right? Because again, we're looking at underlying issues that if you fix them right, your performance is going to go up. Okay. Okay, talk about performance. So things like memory, your mood, your stress, stress levels, your resilience to stress improve. We've had the story that I'll share later. I think is that about behavioral change, right? That one very hard to how to objectively record, right? I can't put a number to it, but yeah, that's why I think in a lot of research that you read regarding like psychology, it's a lot of ground research where you have to approach it with a very open mind, and then you see what emerges. Okay, so anyway, EQ, IQ, right, and brain reserve and immune disorders. I may not want to go down this road, but brain-gut connection, right? So there's a connection between brain and the gut. Okay, I'll just leave that there. And how do you, as a social worker, fit into this approach? Yeah, this is my question. Because I find that we have certain struggles also. Mentioned something about therapy fatigue. You can lead the horse to the water, but you cannot force it to drink, right? And then, so how much should we encourage before we kind of stop, all right? And I think that having an individual that has a large focus on the patient is very, very useful, because sometimes if we are seeing a lot of people, we may miss certain things, or we may miss certain events that might happen in their life, and then it affects the way they perform in the clinic, for example. So I think you guys are important for that. Of course, we don't want to be so dependent on they shouldn't be too dependent on you also. Oh, okay. The guys at the back can hear me? All right, good. Okay, so I also want to kind of raise awareness, because, I mean, have anybody heard about this before? Doing like massage on one side of the body, all right, and then measuring brain change from that. I think this is quite new. Even in the field of functional neurology, this is also quite new. If you are reading into it, and I'm interested in functional neurology, you see a lot of fancy stuff, right? So you see people in roller coaster things, you see people